Welcome back to another episode here on the Hart Hustle podcast. Our next guest says, I'm a master's level social worker, and even I get lost trying to navigate healthcare. That's the problem I'm here to fix. That's Kerri, Chief of Staff of CenterWell. How you doing today, ma'am?
Hey, I'm doing good. How are you?
Are you excited about today's conversation?
I am excited. I'm so happy to be here with you. I mean, who wouldn't want to spend some time with you talking? It's so
I
easy,
know.
so
I
nice.
appreciate you. I mean, surprising that you even have the time. I know I said it offline, but beautiful background. All right. The
Oh,
aesthetics
thank
is
you.
gorgeous. These pictures, tell us what they're about up top.
These are my husband's grandfather took these pictures with a famous
No
artist back in
way.
like the 60s.
So
And
these
he
are
passed
official
away a couple of
photos.
years ago. Yeah. He passed away a couple of years ago, and so we keep him in our house. He
Oh,
was like
that's
the
amazing.
original cool guy. Yeah.
Yeah, and those are nice
Yeah.
pictures too.
Yeah.
Wow. Is
Yeah.
your husband doing
So
photography now? Is he keeping that
So,
alive or?
so don't let him hear me, but he does. He wishes he was a photographer. He is a pharmacist. And
Oh,
I'm
he
a
still got
social
time.
worker.
Still got
So,
time.
the conversations are just wild. My sisters are nurses. So we have the whole thing covered, but he does. I think low key, he wants to be a photographer. He has a lot of equipment he likes to bring on vacations.
I
He is that
love
guy.
it.
He is that
He
guy.
might he might be into it. I always see people who just pivot their careers. So who knows? He goes from
I mean,
pharmacists to
it's a cool
photographers.
thing. We
It
were
is.
just recently at in the Keys, Florida Keys, and there was some folks selling jewelry on the beach, and I was like, I don't know. I think I might be able to do that one
That's a
day. Like,
vibe.
how do you like your vocation? Is it working for you? Because it looks like it could work for me.
That is
It's
too
interesting.
funny. Well, listen, you started in social work and
Yeah,
now you're shaping the healthcare systems as we mentioned.
yeah.
How did that happen? Like, as we mentioned, just pivoting with your husband, he might pivot, but you really did pivot. So talk to us.
Did.
How we got there.
I think, I think helping was just so inherent in my life. My father is a minister. I grew up in church. Seeing people who needed help and see people how they should be helped was very common to me. So
Mhm.
I think I naturally gravitated towards it. But when I realized it could be a profession, probably like in my, early, high school, really beginning on thinking about college years, I gravitated towards social work. I actually interviewed all these social workers to think about like what could a career be like,
Mhm.
and so I wanted that direct connection with folks. I think I like the idea of hearing people's story, and I like the idea of maybe being able to say some words that make them feel better. But I think as I gravitated into social work more and more, I realized there's like a strategy to doing this. Like you can't just sit there and listen to someone. And a lot of times maybe that's all that person needs. But I started to think about populations and macro ideas and how did people get here in the first place and why. And so it kind of led me to more strategic thinking, I would say. I started to gravitate more towards program development and think about the larger issues than I did sitting and counseling a person on one to one. I did that for a little bit with veterans and I got a lot out of it. It helped me understand some of the reasons why these larger picture macro issues are sort of happening from the firsthand experience. But I quickly pivoted to thinking about program development. I spent a few years building care coordination programs in New York for a few different nonprofit agencies. And then even within that, I started to realize, wow, there's even this bigger picture of the health plans and the payer world and who sort of holds the cards and how we can direct care. So after spending a few years in the social work world within care coordination, I wanted to make that first pivot, which was understanding the payer world. And I spent 6 years working for a payer
Wow.
and understanding how they look at a care delivery system, right? So I was in a care delivery system. I was working with patients every day, and there was this other system that we were interconnected with, and I wanted to realize and learn more about what that was. So I spent 7 years there and saw a whole nother way that folks look at healthcare, right? It's very connected to our structures, our government, our systems. And so, yeah, I think I started to realize I'm like peeking behind the curtain and seeing how things are being made. It was really helpful for me to understand where I wanted to be in that structure.
And now you're doing it at a high level, working with seniors, working at CenterWell. I mean, going
Yep.
up the C-suite ladder, maybe one day CEO, maybe that's in the cards. We don't know. You talked about maybe at the beach, so maybe there's something there too. Um, what are you excited to kind of, last time we spoke, born and raised New York.
Yep.
Does it feel even better knowing that the work that you're doing is pretty much your backyard? It's your community, is where you grew up at. This is that exciting you as well to know that you're still in that space
Yeah,
where you grew up?
I think what was really interesting was when I was, right working directly with patients, it would only be like a 20-minute drive from where I lived to where these folks lived, right? And I was finding them homeless and trying to understand where their next meal was going to come from. And so it feels like it is right in your backyard. I think what's been really interesting is as I deepened my experience with the macro level and working
Hmm.
with national level companies, you understand that it might not be your specific backyard anymore, but it's the same picture. These
Yeah.
folks are in need. It's across the country. It's the same for the family that I was speaking to maybe 10, 12 years ago, right in Copeg, New York, where I would be finding my patients under the train trestle to understand what their needs were and how it can get them to their next safe space to stay. No different from when I now travel to North or South Carolina and meet folks that are seniors working, living in their area, trying to get better care, coming to a local CenterWell center to be taken care of, right? We're people and our needs are really universal. And so I think that was a big piece of what helped me want to look at the bigger picture was I could talk to this one person and understand what was going on with them, but there's a lot of people like them. And so if
Yeah.
I could think of strategic ways to help the system, I felt like that's where my skill set could be used.
So you mentioned it, CenterWell. For those that may not be familiar with
Yeah.
it, talk about it. What are you guys doing there? What is it all about?
Yeah, so CenterWell Senior Primary Care, we are sort of the care delivery arm of Humana. And we help seniors in, it's over 17, 19 states. We have almost 400,000 patients. We are there to give them all the services they need. So we're their primary care physician, to which a lot of times we are the only source of their connection to the system. And we're helping them understand what they need, how they need it, better quality of care, more efficient ways. We serve them in a value-based care arrangement. And so we are committed to making sure that they get better outcomes. And we're trying to think of really innovative ways to do that every day.
Love it. And I remember when we first spoke, you mentioned if you can't navigate the system, imagine what it's like for grandma. Obviously, there's some experience there as well.
So
Well,
true.
but what's that one thing most people really don't understand about the senior care experience in general? And I think that's where,
Yeah.
we all don't think about it because we're not there, but we all
Yeah.
going to get there.
Yeah.
So tell us,
It
what is
is
that?
so true. I think it's really interesting, like thinking about your own mortality, and it's something that not everyone is so comfortable doing. And so I do think that folks shy away from, oh, that's not me now. I don't have to think about that yet. But as soon as you get a family member or a close friend that is in that space, you
Hmm.
will very quickly realize this is a puzzle piece that is a puzzle that's very hard to solve. I would say our system is very complicated, and that's giving it a lot. It is intimidating. It's confusing. And so when you have a senior who's just trying to understand the basics of what I
Hmm.
need, trying to even articulate the basics of what they need, and then it going into this sometimes feeling like a black hole of a healthcare system, they need advocates to help them through. And that's really what CenterWell primary care physicians are being. They're being the advocate for that patient
Hmm.
because they know it's hard. They understand their needs. They want to have them feel belonging with us so they can call us first before you have to go to the hospital. Speak to us about your needs before you have to get a much more traumatic, unnecessary level of care that we could mitigate first.
Yeah.
So I think there's two sides of that coin, right? It's families who want that for their loved ones. It's physicians who want to give that to their patients. And so it's a really great thing when they meet. and it's effective, it doesn't always happen that way. I often say this, like healthcare for folks, me, again, master's level, it's like you have this puzzle you have to put together, and somehow your puzzle pieces you have, they don't match up, they don't align. You have like a monopoly piece in there as well. It's a really hard thing to understand. So I think what CenterWell is trying to do is make it easy and simple and talk to their patients more and hear them more so they can give them the care they need.
I mean, and of course, with you at the tippity top of it, or
You too,
not so
Ken.
much CEO yet, but we're pretty close, right?
Oh, man.
You're the strategy mind who knows what it feels like on the front lines, which
Yeah.
is rare. How does your background make you a better partner to clinical leaders?
I think that is something that more and more over the last couple of years has stood out to me. I have been in charge of the departments before, right? I've run sort of the end to end in the program, making sure you got your P&L in order, you have your staffing and your overhead in order. You kind of know what your piece of the pie has to be. I think in this position, being able, like having the honor to work so closely with the chief medical officer, like Dr. Vivek Garg, who's the chief medical officer of CenterWell Primary Care, who gives me the space to support and lean in and understand, hear, really just be at the table so I could hear. It helps me insert my experiences in a way that I think brings real life to it. I think I could say, I understand the demands of the folks in this room. I've been there before. I understand that there are competing demands and how you have to understand business perspectives and keeping the patient at the center of it. So can I share an insight here? Can I make it make sense here? Can I engage with leaders that are sitting with millions of things on their desks to do, and they really just want to help patients? Can I help make that easier for them? And I
Yeah.
do think my ability to say, not just lip service of I know what you've been through, but I do know what that feels like to have these competing demands. But I think I can help you in this way, and let me help you be a thought partner to you, and then help take something off your plate. I do think that's been impactful for the leaders around me.
How long have you been with CenterWell?
It is going on 2 years now.
Wow.
Yeah.
That is a long time, but it looks like what you're kind of saying is that you love the place you're in
I
because
do.
there's the difference between that thought partner and executing someone else's plan. But you're not just executing someone else's plan. You truly are, as you mentioned, a thought partner. They're
Yeah.
listening to you. They know your value in a sense. It looks like companies know your value. And being with such a team like this, what are some of the leadership skills that you see CenterWell actually bringing individuals like yourself, but also those that join the team? Because one of the biggest things that I hear is people don't feel valued at the table. But you're saying, no, I feel valued.
Yeah.
Like they truly do care what I have to say and when they don't need to, right? So what are some of the leadership things that you've enjoyed being there for the last couple of years at
Yeah.
CenterWell?
I got to tell you, I was hesitant to be really honest. I came through an acquisition. So I was helping a company who was doing in-home senior primary care. So similar, but we were in the home. We had no brick and mortar locations. We were driving our doctors around and caring for folks in their homes. And they were all seniors in the same sort of boat needing that type of service. And we were acquired by CenterWell Primary Care. And I was like, oh, I've done the payer world before. I understand this. Wasn't I learned a lot, but it wasn't where I wanted to be long term. I wanted to be closer to patients. And so I was like, all right, I'm going to just, feel this out. I see how this acquisition goes. And then candidly, I met Dr. Garg, and I was like, wow, if this is the thought leader running this clinical organization, then I could get behind this. He's just genuine in his approach, wanting to keep clinicians at the forefront because he knows good, taken care of clinicians take care of their patients really well. And I was all about that message. So I was like, sign me up. Like, I want to stay. Like, the work that they're doing at CenterWell Primary Care to engage and retain and sort of honor their clinicians is admirable, because they are taking their feedback from the clinicians and they're saying, we know we hear burnout. We know we hear there's turnover because it's not an easy job. If it's not easy to get into the system from a patient's perspective, think about the folks in the system trying to figure it out themselves and work in it
Yeah.
in an effective way. It's all really messy. And so I think that they're, you know, admitting that and wanting to be better at how to help their physicians navigate that. So ultimately, their patients do get that better care. And so I think those are the leadership qualities that I quickly caught on to, that I was like, I want to be a part of this. I think I have a skill set that could help these leaders build this plan more. And I am really honored that they let me sit at the table, because they do. If they didn't, then I wouldn't have that seat and I couldn't share these
Yeah.
skills. And I think that's what we need more of. I think folks have to understand talent and what they can bring and open the door for them so they can be there. And that's what Dr. Garg has done for
Yeah.
me. That's what I hope to do for the folks that report to me. And, I think that's the piece of leadership that makes it make sense.
Yeah. No, I like that. I do feel that so many times people are very great talents, but because, like you mentioned, sit at a table and feel unheard, unseen, they leave. They go
Yeah.
elsewhere. And you could have had the same opportunity, but if it wasn't for that great leadership that you were just seeing, right, during this being acquired, you could have also done the same thing, but you stayed. And I'm gonna have to put you in the hot seat because you mentioned a couple of things.
No.
So, if there's one thing that if you say you walk away from CenterWell today because you're on the beach selling jewelry, okay, and you took one thing with you, one great gem when it comes to leadership, what is that? What is that one?
I think it's a hard one to choose one. I find that engagement with levity is very
Okay.
helpful in leadership. I think folks want to feel like you're present. I think they want to feel that you're real. I think they want to understand somebody here has a vision that I could get behind. And they also kind of know what's going on. They're not just a
Okay.
face, they're not just a name. I think they can be down to earth and real. That's how I try to approach leadership.
Yeah.
I try to say, I have this thought, I have this vision. I think it's good for this reason. I'm also a human being, and I think that you should be able to be real with each other to understand really hard problems. We could do hard things. There are hard things to solve, but we can, and we could do them in respectful and good ways together, maintaining our engagement without having to have so many abrasion points.
So I listened to your doctor, like a very great person seems to work for, and I love those type of CEOs that say
Yeah.
open door. You see them in the hallways, they're talking to you, like they're not afraid to have conversations with you. So many times people are scared to have those conversations with their presidents and CEOs of a company, and it's really that's what they created. That's the atmosphere. So I love that your president CEO has created the atmosphere that says, hey, we're all in it together. Do you feel that this was new to you? Like in the past, were you getting that? Because it feels like that's really what you go to is just feeling like, man, this is
Yeah.
just another person.
Yeah.
Like holding a title, but the title, it's not making the person. The
Yeah.
person made the title.
I
Like,
have,
do you agree?
yeah, totally. I've had those experiences where I have felt leaders, like my very first mentor, my first leader I had right out of college was totally open door. So, led by example, the exemplary way to lead. And I was like, wow, like this is how I want to be. This is the leader I want to be. I want folks to understand there's a good way, we can move forward and we can do it together. So I have had those experiences before, but I have also had the other where the leader is like, there is no room for you to speak here. It is what I am saying. It is not what you are saying. And I have seen the stark differences between the type of products that could be built in both of those examples.
Yeah.
It really is not. I don't think it's hard for people to understand that when you have a more open person, there's more ideas, it flows, the vision is there. When you don't, you don't. I don't think people, there's not a lack of understanding of that. I think it's more about doing the work, and being a real authentic leader is harder because you have to have things to say and do, and you have to be able to engage, and not everybody is so comfortable doing that. So I think it's the better way to be. It's not always the easiest way to be. And so I have learned that's who I want to be, and I can quickly see others who fall in that same sort of category and others who do not.
If the Heart and Hustle podcast has ever sparked any idea or made you think differently, do us a favor. Make sure to guys share this, post it on LinkedIn, or even text that nonprofit friend that you just have. Whatever works, this is what keeps the conversation going and allows us to just grow this community together. Seriously, we appreciate you. All right, so now I'm gonna reverse this question.
Nice.
All right, CenterWell has poured into you, but we can't just take and not pour back into it. What do you bring to CenterWell from a leadership perspective, right? You've had the experience, you've seen great leaders. So now what are you bringing to the table for CenterWell that has also kind of been like an eye opener for them?
Yeah, I think what folks would say is that I bring a authenticity to my strategic engagement, my strategic direction. I think that my keen understanding of what the type of work is and my ability to say, we have to think of it this way and we can do it, and I can help you think through it this way. And I have been there before, and I think we can find a way through this hard time. And let me take some of the work because I know how to do that is helpful. I think I'm also a really good listener. So I think that folks find it pretty easy to speak to me and talk to me about what they need to move in their areas. And I think I can take the key points of that pretty well and then help them execute on it. So all of those skill sets started in social work, right? A social worker is there inherently to listen, to help build the bridge, to help understand what folks on both sides are wanting so that we could get to a solution. Solution focus is like what social work is trying to do. And so I think the mixture of sort of being raised in that social work world, sort of where I grew up in the social work concepts, and then having some hands-on operational experience in the work has helped me sort of bring all of those tools together to help advance the work that we're trying to do. So I hope that is what the folks around me are seeing. That is what I try to do every day.
Okay, I love it. I love it. Now that we got that out the way, I want to talk about how we continue to care for our physicians. We're
Yeah.
in a place where I don't really know because I'm not in it, but I know that there was a decrease, right? People were
Yeah.
leaving, they were finding other things to do, and some may say it was really feeling overworked, right?
Yeah.
Feeling burnt out. The pandemic shifted the mindset
Sure.
of so many people that they decided to walk away. But now what I'm seeing is that we're helping our doctors from actually still doing notes in the middle of the night to have more AI tools to really bring AI to a space to do things so we could do things more of what we love and less of the things that we hate. Because you didn't go to school to sit here and do paperwork all day. That's not the thing, right? Is that people. So are you guys seeing AI play a change in what you guys are doing on your day to day, or are you guys not there yet?
Yeah, absolutely. That is a big focus of what we're trying to connect to our physician engagement, physician retention. We are all about making sure that we're doing things in a smarter, more efficient way, leveraging AI in the sense that it empowers intelligent, certified, qualified to do what they're doing folks to do it better. And that's essentially what we're trying to do, right? So you said it, folks are overburdened. There is a lot of administrative burden that comes onto our physicians. They did not want to come to this field to fill out paperwork. They want to help patients. And so one of the big things that we're leveraging is AI to help them do their notes more efficient, faster. They can speak into their cell phone. The app can be on their phone. It then generates their notes for them to review. This is more than just time savings. When we have taken testimonials from providers, they are saying, like, my anxiety is lower. I got to
That's
eat dinner
good.
with my family. I got to talk about my job today and not be stressed out about what I have to do in the middle of the night once my kids go to bed because I have to make sure my notes are closed. AI is helping shape the way that we're going to think about the art of the possible. Like, what could we do if these things were not taking so much more of our time. What more could we do with our time to help patients? How do we make more impact in their lives? So absolutely on the forefront of probably every meeting that I have from day to day is how do we leverage AI? How do we think ahead of the curve? How do we make sure we're doing what we can do to make it easier on them? Because again, easier on the physician is better, more at ease patient care.
Yeah. No, that's so good. And I can only imagine that I'll make sure I clip that exact moment of how you said someone gains back time with their family.
Yeah.
Because if used right, it could bring you that. It could bring you back the time that you felt you
Absolutely.
haven't had in a long time. Maybe it's to go work out now. Maybe it's to go spend time doing that hobby that you've always loved, haven't had time. It is your kids, right? Being there more present for your kids. And I still hear so many people kind of in that fear space. And I'm like, it's here. It's not going anywhere. And then something else you brought up that was very interesting is that you said they could just talk into their phones. And at one point in our lives, we were afraid from the computers. I believe like 1998, we were afraid of computers. But we carry computers in our pockets. Like we're having conversations. And in reality, that every time you were having a conversation before AI was a sexy word, you were already experiencing AI. We just weren't calling it that.
That's right.
Right. So I love that you guys, as you mentioned, at the forefront is how do we continue to utilize this to our advantage so that we could have better experiences? Because to me, the experience is everything. And I always bring this up. I went to this hospital. I'm waiting to go to a hospital that has these AI transcribes now because I believe the experience will be different. Because I've been to the person that goes to the doctor and the doctor never looks at you, doesn't even know what eye color you have. Like they can't tell you anything, to be quite frank, other than what you're telling them, right? And I think that in itself, for a lot of us, have created a bad experience. And as humans, we just want to have a good experience. That's what makes us want to go back more. But once we have that first bad experience, we go find elsewhere. We just don't go back. And we used to have family doctors that would take care of the whole family. That doesn't even exist anymore because the experience is not the same what we used to. So I think what we're doing now in the AI and trying to just help people get back to giving and helping like they wanted to, I think we
Yeah.
would definitely be able to get back to those places. So I love it. I love that you mentioned what you did,
Yeah,
Kerri. That was
for
on
sure.
right on the head, man. I'm clipping that.
I think it all comes down to trust. And so if we can find tools that our physicians can trust is going to make their job better, then they're more confident using them. And then they can show their patients, we can trust how we're thinking about these things because we're helping you. And this is good. And that's what patients want too. They want to trust their physician is doing the best for them. And that's arming them to do so.
I love that. How can everyday people just advocate for better senior care in their own communities?
I think that it's not as complicated as people think, candidly. I think if you have a neighbor and they're older and they need support and you support them, you are supporting the senior population. I cannot tell you how many times casually folks think, oh, you're the social worker, I'm going to ask you for help. I'm not doing groundbreaking things for them. People just want to feel heard, they want to
Yeah.
feel connected. And so I would say, if you are a loved one or a friend of a senior, stay connected to them, reach out to them. If you are not, then find ways that you can in your community. There are really easy ways to do that. And there are more sophisticated ways if you really think about the career of social work or engaging in the medical field in some way. But I think we have to make it really simple for folks. I think finding someone who needs that support and giving it to them is how you can make a big difference in their lives. I recently was talking with someone and they said sometimes, when you talk to a senior, they only talk about one or two things. And they keep saying the same thing over and over again. They don't have too many interactions in their worlds as they get older. The interactions get smaller and smaller. And so what you might be for that person versus what they are for you could be very different. My
Yeah.
husband's grandmother needed a medicine dropped off to her maybe a couple weeks ago. And it was like 4 p.m. Their lights were off. They were ready to get ready for bed. It's 4 o'clock in the afternoon. And I came to them and I gave them their medicine and we talked for a little bit and she was so happy. And, maybe I was the only additional person they saw that day.
Yeah.
So I think there are small things that make big differences. And I think in the community, you could do that. And then I think there's absolutely space for us to be responsible in the way that we handle these macro issues, in the way that we deliver care, and the way that we take care of our seniors in healthcare, and make sure we're using the most innovative ways to do so.
I'll tell you what, I used to work for the airline industry,
Mm.
right? Picking up calls. So a lot of these calls, it was people with issues
Okay.
most of the time, right? That's why people call. They don't tell you the great things. But they would call, they couldn't work the website, change, cancel, whatever that is. And when I get to the elderly, I'll be on the phone for an hour.
Yeah.
But you know what? It was a fun hour. They were great to talk to. Like, it was never a dull
Yeah.
moment. They're sharing
Uh-huh.
stories, and it just always put a smile on my face. Like, as you mentioned, they just wanted to have a conversation,
Yeah.
and that I could be that for them while they thought like I was great. I'm thinking like, no, you were great,
Yeah.
because not everyone calls in with this kind of attitude and sharing these type of
Sure.
stories. I was actually talking to my friend last night because obviously there's been a lot of deaths right now, Hulk
Mm.
Hogan and Ozzy
Yeah.
Osbourne, all that,
Mm.
and we were just I was just bringing it up, like,
Mm.
how people, Ozzy Osbourne got to die the way he wanted to,
Mm.
performing on stage. How
Mm.
huge is that? So I was letting her know that when people go into hospice, like, they also help them try to live out those dreams that they've always had. And I've heard some phenomenal stories.
Okay.
So I was telling my friend, I'm like, man, we should start like volunteering at some of these homes
Mm.
or, centers, because there's so much to learn from them. This used to be a former CEO, a former athlete, former whatever, right? Like, they have so much information. If you really want to learn, go speak to someone that experienced life.
Yeah.
So I love what we're talking about now is people don't have those conversations often, and
No.
not realizing that also lessens their life a little bit,
Mm.
right? Because they feel like, why am I here? They start to
Mm.
think that way. The body starts to,
Mm.
feel that way. So I'm always a big believer.
Mm.
I think I'm good though. You know what I'm saying, Carrie? Me and you probably good. We talk. We like to talk. Being a social worker, you have to talk. You had to. Like, that's how you're getting information out. So I think we're good. But to those people that don't realize, it's okay to have a conversation.
Yeah.
It's okay to say hello. Sometimes they're staring at you because they just want to. They just
Yeah.
want to talk to someone.
It's
Give them
really
five,
true.
10 minutes. Truly makes that difference. So Carrie, I know you're doing amazing. I can't wait till one day you say, "Listen, I got promoted to CEO. Okay, my
Oh
CEO
boy.
stepped down or
Oh
retired or whatever
boy.
that may look like."
Big dreams on the beach selling jewelry somehow.
Never. If that happens, you gotta tell me, Carrie. You gotta tell me.
We will.
Listen, as we start to wrap things up, where can people find you?
Yeah.
LinkedIn, if they wanted to connect with you, but also just the website for people to find out more about CenterWell.
Yeah, you can find me on LinkedIn, and CenterWell is a primary care organization. If you search them up, you'll see them right away. They're across the nation having centers helping seniors in their local communities. So there's a lot of opportunities within the company. So you would also see that. But yeah, reach out to me. I'd love to talk to anybody, anytime.
All right. And the blind question: what's one thing social work taught you that you still use in everyday leadership meeting today?
People are human. We all are. And so we all have a lot of the same thoughts and fears. And that if you give space to just talking to folks, those come that comes out pretty naturally. And
Right.
so you really can have a conversation with anyone. That's what it taught me.
Isn't that cool though? That I'm pretty sure you've had conversations with people and you think you're telling like this secret in a way, and it's like, oh, and they'll start to share their story, and then
It's
you
really
realize,
universal experience.
yeah, wait,
Yeah.
we're just alike.
Yeah.
I'm a big believer in when I have these conversations, I always tell people, I speak to CEOs, C-suite execs in different,
Mhm.
areas. We're all human. Like, our titles don't make us any different.
Mhm.
When we die, we go to the same dirt at the end of the day.
Mhm.
So I hear you. We are all human, and we got to be kind to each other.
Yeah.
We got to be kind to each other. That's the
Yeah.
difference between life and death, I believe, a lot of the times.
Mhm.
It's just being kind to each other.
Yeah.
Having conversations like this. And what I love to have these conversations, Carrie, someone may have taken something that we
Mm.
given them today, and we will never know
Yeah.
that they ran with it.
Yeah.
And
More
that's why
often you
having
don't.
conversations. Yeah.
Yeah, more often you don't get to see you've sown something. You don't always get to see it grow,
Hmm.
but you still put the seed out there. And I think that's part of opening up the conversation, letting there be space so folks can share their experiences. Whether they're talkers or not like us,
Right.
everyone has an experience. And so if you're honored enough to hear somebody else's, be kind to them and give them a little bit of yours. And that's really what we need. That's what seniors want too. So there's really no different.
You ever try to talk to someone that doesn't like to talk
I
and still get them
have.
to talk? That is always the best. Like, yeah, you can tell they're not trying to talk, but by the end of it, they got a smile on their face and they're just having a good old time and realizing that they've talked to you for 15, 20 minutes.
Yeah. Yeah.
Those are always the best
I
because
agree.
they have these guards up.
Yeah.
They same like, they want to talk. It's just they have these guards up for whatever reason.
Yeah.
And they find someone authentic like Kerri that is just wants to talk. How you
Yeah.
doing?
Yeah.
Like there's just
Yeah. It
you
can be
can't be mean to
scary.
that person. It
It can be
is. It
scary.
is very.
It can be
But
scary.
what is your blind question to the next leader?
I would say, where do you think we need to take this next generation and how we maintain our human connection with each other? How do we
Mm,
stay connected as humans? It's kind of something that has been around my discussions the last couple of weeks.
yeah.
With all the AI,
It,
all the good things, how do you keep the human? How do we stay connected?
that is true because I'm finding out more people using AI for therapy.
Mm.
More people using AI as an assistant. All right,
Mhm.
it's just so easy to have the
Right.
conversation. Like I'm not gonna lie to you. I talk to
Mhm.
AI all the time.
Yeah,
Whether
sure.
it's here on my computer or my phone, and it's really for business reasons. But now twice I've heard somebody use ChatGPT
Mm.
as a therapist. I'm like, holy
Mm.
crap! All
Yeah,
right, so you go
yeah.
back. What's crazier is that people don't believe that
Mm.
AI can have that human interaction,
Mm.
but there's people using it already for that.
Yeah,
That it doesn't can't show empathy, that it can't show
yeah,
this, but it's how you prompt it. So it is a very scary world
yeah.
when I'm pretty sure, Kerri, back in our young days, we
Hmm.
were outside kicking the ball, riding our
Hmm.
scooters, riding our bikes, getting
No
hurt. And
phones, no phones,
nowadays,
no phones. Yeah,
yeah, no phones.
no
Yeah,
phones.
you fall, I can't take a picture. Nowadays, they're just inside. They're streaming.
Yeah,
They're playing games.
yep.
Which is all great. Hopefully, I always wondered, do we have as much injuries nowadays with kids? Probably still, right? Because
Probably to some
even though you're
degree.
not outside,
I think it's more of that, like, how do you I think you have to realize this is the world we're in. Like my son is on his tablet and wanting to be on it and doing all these games, watching documentaries, he's doing everything on his tablet. But how do we still maintain that we're the human leading it? Like how do you still keep that connection? I think is going to continually be the question we have to ask ourselves as a population, as a community, because we are going to have a lot of supports and we should use them. We should also think about how to still be authentic with them as well.
well, I won't take too much of your time, Kerri. You have been phenomenal to talk to. I know we
Oh,
can
you
do this
too.
for another hour
You too.
if
You too.
time actually permits, but we got things to go do.
We
So I
do. We
appreciate
do.
it. You guys make sure you guys subscribe, like, comment. Kerri, has been a pleasure having you on the Heart and Hustle
Thanks.
podcast,
Thank
and
you.
we'll catch you on the next one.
Sounds good.
Laters.
Thanks.